All right, can everyone hear me? We're good up in the back? All right, so just a few thank yous. First, we'd just like to thank Joyce O'Doherty for supplying, celebrating this opportunity to start a speaker series, to providing the funds to get this going, because it's really exciting. And also to say thanks to Heather for asking both Aaron and I to speak at the first inaugural series. We're very excited to share not only our work, but also the HIPP Collaborative. We'd also like to say thanks to our colleagues who are really excited about HIPP. Again, Aaron and I were very much at the forefront of starting the HIPP initiative, but it's very much an HKR initiative. So just to recognize our colleagues who are also in the room. And then also to thank you for coming to this Tuesday night to share and to learn and to also dialogue about health and wellness, both here, the research that is being done, but also within the community. So thank you to you. So just to kind of what we've got planned for you today, we're going to start off with just some introductions. I've got just some pictures to share about who Aaron and I are. We'll start a little bit about, we'll ask a reflective question of what is health? What's our meaning of health? What do we conceptualize as health? I bring a very sociological lens to the work that I do, so that very much grounds my work around health education. What's the health? What does health mean to all of us within schools, but within communities as well? Erin will talk a little bit about her work in physical activity, specifically within cancer populations. We'll talk about how we've brought our two expertise together, our areas of expertise, around the topic of cancer stigma. And then we'll end with talking about the HIPP Collaborative. What's the HIPP all about? And what does HIPP stand for? I just wanted to also share the picture that's on this screen, again, to get us thinking about the meaning of health and how our ideas of health and performance have changed over time. This picture is taken from the 1920 Tour de France competition, where it was believed that if you smoked, if you lit up a cigarette at the beginning of the hill, that helped to open your lungs prior to climbing the hill. So this is them lighting up a cigarette prior to climbing one of the big mountains. The other thing I wanted to just point out is they're wearing helmets. So again, ideas of health have really changed a lot within society. So who are we at Dr. Cameron and Dr. McGowan? We're researchers, and we're passionate about research that we will share with you today. But we're also mothers, young families under the age of 5, and that we're also athletes in our own rights. So we're constantly not only interested in health promotion, we also walk the walk in terms of we participate in lots of different activities. We also bring our kids out to as many activities as we possibly can to promote the idea of healthy, active living. So not only in our research, but in our everyday life as well. So let's start off with a reflective question. Again, the lens that I bring, I'm going to start off with getting us thinking about health broadly, and then actually Dr. McGowan is going to share some strategies around physical activity. So we bring different lenses and different approaches to the work that we do. So this question, what is health? And what is healthy living? I'd like you to think about what are the first things that come to mind for you when I ask this question. Maybe come up with 3 things. What are the top 3 things that come up when I ask this question? What is health? Just take note of what are the top 3. Sorry? Sure. Well, nutrition. Okay, nutrition. What else?
Being physically active.
Being active. What else? Balance. What else?
Living in a healthy environment.
Healthy environment. Great. Great. So what was it at the back? Mental health. Mental health. Great. So let's, in that same vein, I'm going to ask a different question, but in a similar way, or in a slightly different way. What does it mean to live well in the world? Think about, again, what are the top 3 things, if anything, if they're different than the first question. What does it mean to live well in the world? Are they different? Is it a different question than the first one? So when I do this activity in my classes with my students, the first one, when I ask the question, what is health, I get a very standard answer, very similar to the answers that we came up with. Physical activity, nutrition, healthy eating, sleep often comes up as well, mental health. But when I ask the second question, a lot of different things come up. Walking my dog, listening to music, laughing with my friends, sex, comes up. So we get a very different answers than the first one. And I always ask students, why do you think that is? Why do you think when we use the word health, we come up with, again, this almost in-the-box thinking, whereas we start to ask different questions, we get different answers. And so it's just in this vein of what is health and starting to think about how we conceptualize health within society and how we're taught to think about health. I'm also interested in the barriers. So not only how we think about health, how we live healthy lives, but also the barriers to health. And this is very much that contributes to my work around health education. So what I'm interested in is how we learn to live well in the world. What I mean by that is how we're taught to do, think, and experience health in various settings. So school settings, community around us, within universities, within healthcare. What are the messages around us that teach us what health means, particularly around what the healthy body means? And this is what a lot of my research is focused on, health-related stigma, how bodies have been portrayed around this healthy ideal, particularly around how we have a very distorted body, a healthy body ideal. And I'll tell you what I mean. So there's this focus on individual responsibility. Very much, it's simple. Eat less and move more. That's the simple message often within public health campaigns. You are what you eat. But this approach is very shifting away from the broader social determinants of health. It doesn't complexify the complexity of health. It's very much a medicalized way of thinking about overweight and obesity. And there's this assumption that everyone with excess weight is unhealthy. Also, this approach in how we conceptualize bodies and health in particular, because this idea of the body becomes a visual confessor, that moral judgments are made based on body shape and size. So a lot of things are thrown out based on different shapes and sizes of people's bodies. And I'll show you what I mean. So I have two images here for you to look at. And what I'd like you to do, I'm going to read the descriptors on the bottom, and I would like you to identify these are two friends of mine, which body you think is described by these different terms. Okay? So which of these two bodies, friends of mine, do you think is the marathon runner? Sorry? On the right, right. Which one do you think is organized? Who do you think's the knitter? Who do you think eats a lot of junk food? Who is a good canoeist? Who loves going outside and enjoying the great outdoors? Who's a good leader and who's socially awkward? I hope you're getting to see where I'm going to. I'm going to tell you about my two friends. On your left-hand side of the screen, that's my friend who's a marathon runner. She has run 6 marathons in her life. She's amazing. She's organized. She's a great leader. She loves the outdoors. She canoes all the time in her life. My friend on the right is socially awkward and eats more junk food than I think anyone that I know of. She'll often say to me, I can eat whatever I want and I never gain weight, but people think I'm healthy. And it's true. And so that idea that we assume a lot based on different body shapes and sizes. But we're not to be blamed for our assumptions because we are taught by a lot of the things around us, around what is this idea of healthy bodies. So I'm going to show you some different ways that media represents bodies all around us. So here are some magazine covers that we see in doctors' offices all around us, around, again, bodies of women. And again, it's all about, it's easy. So you can get the bikini body in 3 months. All of us, we can all get bikini bodies in 3 months. It's not just targeted at women, it's also targeted at men. So fight fat and win and you can get abs like that. So it's not only in our magazines, but it's also in our television shows. There's very much this blaming and shaming about different body shapes and sizes. So The Biggest Loser, super size versus super skinny. It's in our advertisements, on our billboards. And this Maria Kang, I don't know if you saw it, was going viral about the body shaming. She was a mom, and she started this website called No Excuse Mom. And she said, what's your excuse? And it was very much about body shaming women and moms for not having a body like hers. It's in our headlines of our newspapers. And it's all around this body shaming. And here very explicitly says we need to use fat shaming as a strategy. But we know that does not work. But what I find also interesting is how we also project ideal bodies around health in our textbooks in universities. So again, these are pinnacles. But what do you see here in terms of these are textbooks that are all in health fields representing health in a certain way on the covers. But what do you see? You see again the ideal portrayed as thin, fit, able-bodied and predominantly white. So not only are we constantly learning about the thin ideal, but we're also constantly learning about obesity and how to conceptualize people who are living with obesity. So these are the images that are used in our media outlets all around the world when there's about obesity. And what do you notice in these images? Dr. Charlotte Cooper calls this the headless phenomenon. Basically, that we use images that dehumanize those who, again, we're putting in society as people who are living with obesity. So it's very much this idea that they're voiceless, headless, and we dehumanize them. Susan Bordeaux, who's a feminist scholar, calls this is perpetual pedagogy, how to interpret your body 101. These images are teaching us how to see, teaching us what to expect from flesh and blood, training our perceptions in what's a defect and what's normal. So this idea of normal, healthy bodies. So this messaging around obesity is all around us. It's simple. Eat less, move more. But I'm here to tell you that it's very complex. This actually is a map that was developed in UK called the Obesity Foresight Map. And it was trying to map all the causal factors of obesity. And the first thing, I mean, look at the map. It looks chaotic because it's so complex of all the factors around obesity. In Canada now, we're starting to recognize that we need a shift in how we conceptualize, how we talk about obesity. A report in BC in 2013 came out called From Weight to Well-Being, Time for a Shift in Paradigms. And I just take a quote from page 9 because I think it really is, it's poignant because it talks about how our current approaches to obesity aren't working. They're actually causing harm to mental and physical health and well-being. This approach of energy in, energy out, or that simple move more and eat less, is not working, and it's actually resulting in unintended negative consequences, particularly around weight bias. And subsequent to that, they actually also produced a report in 2013 that said, not only are we need to change our approaches, but now we need to look at strategies to reduce weight bias within these different settings. So they produced a report called Reducing Weight Bias and Stigma in British Columbia's Healthcare System. This was revolutionary in terms of the world around weight bias and starting to address and the need for addressing within healthcare settings. And actually, in that report, they say we need studies to develop, test, and compare stigma reduction strategies to reduce weight bias. So just a little bit about weight bias. What is it? So in terms of a definition, it's negative attitudes and beliefs about weight that often result in false and negative stereotypes that lead to the unequal or unfair treatment of people because of weight. The research, and it's really started in 2005, so again, we're only 10 years into this body of literature, but I think it's really increasing in terms of the prevalence of the amount of literature because it's becoming a focus. We're starting to realize that it is really important in terms of supporting people to live healthy, active lives. But it begins as early as 3. And this is telling to me, I have a 3-year-old, and in terms of, again, hitting home for this is when it starts in terms of their understandings about weight and health and equating the two. The other thing too, in youth, both in youth and in adults in the literature, is suggesting that bullying or discrimination is now actually more prevalent than other forms of discrimination within schools, particularly, and it's now more prevalent in discrimination based on race, sexual orientation, and gender. And in terms of where it's happening, the evidence is showing that in terms of settings, the 3 most dominant settings in terms of where weight bias is having an impact, a negative impact, is in the 3 areas: education, healthcare, and employment. My work has focused on these 3 areas, and that's what I'm going to be talking about and sharing some of the work. But just in terms of the consequences, again, it's reinforcing, weight bias very much reinforces this negative cycle. So research shows that weight discrimination doubles the risk of developing obesity and triples the risk of persistent obesity. So it's again this blaming. So we get into this negative cycle of if the weight bias exists, then who's going to want to participate or engage in the activities that are the very things that are making them feel shameful for their bodies? So they're going to avoid, and then it leads to unhealthy behaviors. And we're getting into this negative cycle over and over again. So some of the consequences from the literature around weight bias is showing social rejection, vulnerability to depression, low self-esteem, poor body image. And I always find it really interesting because the very things we're actually trying to promote in our approaches is exercise and eating well. And those are the two things that are showing in the literature consistently that, again, this shaming is actually doing the opposite. So exercise avoidance and unhealthy eating patterns. And then also in our youth, poor grades, school avoidance, because again, if you're being bullied, you don't want to go to those places where you're being bullied. And then long-term poor quality of life. So it has a very significant impact on those who are receiving the stigma. Nelson Mandela once said, "The stigma is something that kills human beings, sometimes far more than the disease itself." And I think that's a telling quote. So just to talk a little bit about what the research I'm doing, these are, again, are the variety of projects that I'm involved with. I call it addressing weight bias across the lifespan, because not only across the lifespan, within different populations, and I'm also looking at it within different settings. But these are the various projects, and I'm going to talk about 3 of them tonight. The first one is looking at we're doing a case study of the Janeway Lifestyle Program, and Dr. McGowan is also on this project, looking at the approach of the Janeway Lifestyle Program. Hands up if you know about the Janeway Lifestyle Program. Okay, so some of you, great. So their approach is really unique in the sense that they have really moved towards a chronic disease prevention model, in that they are an obesity management program and they get referrals as such. But they don't talk about obesity and they don't talk about weight at all. It is not in their vocabulary when they're meeting with patients and when they're talking with families. They've transformed in 2009 their approach, and their approach is called Good Health for Everybody. And they recognize that health comes in many shapes and sizes, and what we need to promote is health and not focus on the weight. And their approach is so unique that they're one of the only groups in Canada that have made that shift. So we're looking at their approach and to really understand their approach as a model of care for pediatric obesity that can then translate across the country. So we've just collected the data for that one, and we're doing the preliminary analysis currently right now. So that one's a really exciting one because I think it has the impact to actually change some programs across the country that work with obesity, that work with patients. So the other setting that I work in is in education. So my PhD research was looking at how do we teach in university settings? Who are the leaders that are teaching differently, that are addressing weight bias within their classrooms in university settings? And some of the dominant themes that I wanted to share tonight. One is when I talked to the 26 faculty members from I talked to them about, okay, so your approach, not only what you're teaching, but also what are you encountering in your teaching? The main theme was resistance. Again, the resistance from students, from faculty members, from society to their approach. And I think it was really telling because, again, we resist what we don't know, but also what seems to counter a lot of our assumptions and our stereotypes. It doesn't feel good. So that resistance is immediate. But Bella shares this quote, and I think it's really telling. In terms of where we are in history, just raising it being weight bias, and talking about it is to teach. It might be like teaching LGBTQ studies 20 or 30 years ago. Again, I think just talking about it is actually starting to teach. The other thing they talked about, again, these 26 faculty from 5 countries, was their curriculum and pedagogy. So curriculum is what they're teaching, the pedagogy is how they're teaching it. And one of the things they talked about is starting where the students are at. So again, not alienating. I mean, if you don't about weight bias right away, that's fine. But let's start from, okay, what do we know about obesity? That's why I started with the questions of what is health and how do we conceptualize health? Because that's very much what we've learned from either our formal education or our informal education. And so Nancy has this great quote, my job is to hook them into things that they already think and then kind of waltz them around. This idea that we need to kind of slowly learn about different ways because we're so saturated within, again, the simple message of move more, eat less. So in terms of pedagogy, one of the, again, many of the participants in this study talked about we need to start from where they're at, but then also bring different perspectives. So Jennifer had this quote, and I think it's telling as well. She said we need to start from, again, this medical problem. That's where we're very familiar with that conceptualization. But then what about conceptualizing it as a food environmental problem, as a moral problem in terms of social justice issues, the ethics that we impose our assumptions on different body shapes and sizes, and then not a problem at all. Maybe what we think we know, we don't know. So again, conceptualizing in different ways was, I think, really exciting. But one of the core dominant things that came out of this research was we need more resources. There are not enough resources that, one, show a diversity of shapes. We're all in this room, we're all a diversity of shapes and sizes. And yet resources only show kind of this thin ideal. And so we need to start showing in our resources this spectrum of weights, shapes, and sizes that we are. And so these are just some of the resources that the faculty were using. Also included a few of my own, but that we desperately need more resources. And so that was one of the big things to come out. We need more resources for healthcare professionals. We need more resources for teachers teaching about, again, about weight bias, but also that health comes in many shapes and sizes. I think we're really lucky to live here in Newfoundland. We have actually some really great resources at our fingertips. So one of them is the Body Image Network, developed a number of years ago, the Body Image Toolkit. And it's all based around a storybook about Percy Pinhorn. And Percy, again, it's all about celebrating our different shapes and sizes. And so right now there's a curriculum around for grade 2s and grade 4. They're working on a junior high curriculum as we speak as well. And they're doing great work in terms of advocating for this approach in terms of body positive and not the body shaming. The other thing that again, another resource that I think is excellent is that now within Eastern Health, they have a document called Thinking About What About Your Health? And this has just come out this fall in terms of, again, getting us thinking about the city, and we need to start addressing the weight bias here in Newfoundland. And this is a fantastic document that I'm now working with the group that created in terms of putting it out within Newfoundland more broadly, but giving it some traction. The other thing I'm working on as well is in a sports setting, we're piloting Body Sense, which is a body positive program aimed at coaches and athletes. And it's all about, again, getting coaches to recognize that one small comment can actually have a devastating impact for young athletes around their bodies. And so we need to pay attention as coaches to this thin ideal, and that one comment can actually spiral down into an eating disorder and disordered eating. So we really need to pay attention to our language and the ways that we approach weight within sport contexts. It's complex because there are some sports that have weight classes. So again, not recognizing that it's complex, but that we need to have that conversation is really important. So my take-home messages from this work is really we need to move beyond this eat less, move more approach. We need to complexify. Anytime we're talking about obesity, it is complex. It's not easy. We need to question our assumptions, our own personal assumptions, but also the assumptions in society in general about body size and how we equate health and weight, and really kind of bring those two ideas apart in terms of looking at them. Emphasize health, not weight. Emphasize wellness and not weight. And lastly, we need to start eliminating weight bias. We need to not only we need more resources for weight bias, how to address it as a healthcare professional, how to address it as a teacher, but we also need to pay attention to our environments. Those magazines that I showed earlier, they should never be in waiting rooms, in doctors' offices. Again, those are the resources, those are the things that are informing your patients around this thin ideal that doesn't exist. And so we need to pay attention to the environments that we're in. And lastly, we also need policies that start to address weight bias. There's now 6 states in the US and 1 country that have added weight bias to their bylaws around that it is a form of discrimination. And I think we need to really be leaders in that, not only in Newfoundland, but in our university as well. There's not a university, there's one debating it right now, but we need to add it to our bylaws here at Memorial University as well. So I will turn it over to my colleague around her work.
Can you guys hear me? Perfect. Great. So I just want to start by thanking everybody for coming here today and hearing about some of the great work that we have going on here in the School of Human Kinetics and Recreation. I'm going to shift the focus of the talk now and talk about my research, which really focuses on promoting physical activity. And I'm going to start with a video, and this was actually aired last night, so the Big Bang Theory. And I think it really talks to our beliefs about physical activity and how complex sometimes it can be to adopt healthy lifestyles.
Hey, ready for lunch?
One sec.
Is that the prototype drive system for the High-G rover?
No, Bernadette got me a Fitbit so she can track how much I'm exercising.
That'll teach her to care about your health.
Yeah, I can't wait to see the look on her face when I die young. When was the last actual exercise you got?
The other day when she tried to put that Fitbit on me and I ran away from her.
According to a recent study, simply thinking about exercise, even while sitting still, can have physical benefits. For all you know, I could be exercising right now. Are you? Nah, I'll do it tomorrow.
Wouldn't be the worst thing if we were more active.
You make an excellent point.
Ooh, I think I'm getting a runner's high.
So as I mentioned, I'm going to talk about my research that focuses on physical activity. So in particular, what I'm really interested in is promoting healthy lifestyle behaviors to both prevent and to manage chronic diseases. I'm really interested in physical activity and cancer, and my work really focuses on the idea of how can I get people to be more active to help prevent or reduce their risk of developing cancer, and how can I get cancer survivors to be more active so that they can experience improvements in quality of life and well-being. I'm really interested in physical activity and cancer in particular because of my own family experiences with cancer. So when I was in high school, my father was diagnosed with colon cancer. So this was my first experience with cancer. And thankfully, he underwent treatment and surgery and was a 16-year cancer survivor. And while I was doing my PhD, which focused on cancer prevention, he unfortunately was diagnosed with a second cancer, which was liver cancer, and unfortunately didn't have a very good prognosis. And what I noticed during his treatment is that his cancer care team was really focused on his cancer and really focused on shrinking the tumor, but really forgot about the person behind the cancer. And so he suffered a great deal and wasn't able to do the things that he wanted to do and had really large detriments to his quality of life. And so now a lot of my research also focuses on working with cancer survivors so that they can live the best possible lives following their diagnosis. And so I'm going to be talking about physical activity. So I think it's really important that we understand what physical activity means. And so physical activity is any body movement that works your muscles and requires more energy than when you're at rest. So essentially it means a lot of the activities that we're engaged in. So it can be things like walking or running, swimming, yoga. It could be our activities of daily living. So think about housework, yard work, walking your dog, gardening, those types of things. It can be playing with your children or grandchildren or nieces and nephews, or it could be things like dancing. So it encompasses a whole host of different activities. What we know from our literature is that regular physical activity contributes to meaningful health benefits and helps both prevent chronic diseases as well as manage chronic diseases. And so here's some of the things that it can help improve. So it can reduce your risk of developing coronary heart disease and diabetes. We have very strong evidence that physical activity can reduce your risk of certain cancers. So our evidence suggests that physical activity can reduce your risk of breast cancer, lung cancer, colon cancer, and endometrial cancer. And we have some evidence coming out now looking at other cancer groups as well, such as prostate cancer. We know that it can reduce your risk of depression and stroke and can help you maintain a healthier body weight. It strengthens your bones and your muscles and improves your mental health and your mood, improves your sleep quality. But in general, what physical activity can really do for you is it can help increase your chance of living better and living longer lives. So what do we know about our population and how active they actually are? Unfortunately, the World Health Organization has identified that at least 60% of the world's population isn't engaging in enough physical activity to reap those health benefits that I just talked about. Okay, so really, given the fact that we know that physical activity is so important, and we know that we have low participation rates, as a behavioral researcher, I'm really interested in what are those strategies that we can use to help people become more active and lead active, healthy lifestyles. We know when we talk about behavior change and changing people's behavior is that it's very complex. And so we have, as Dr. Cameron mentioned, these very simplistic messages around our health behaviors. But it's much more complex than that. And I'll talk about some of the reasons why it is so complex. But I like this cartoon because I think it kind of talks a little bit about the complexities of changing our behavior. So the quote says, "The doctor said he needed more activity, so I hide his TV remote 3 times a week." So why is it so difficult for us to change our behaviors? And one of the reasons it's so difficult is because we're creatures of habit. And we do the things and we engage in the behaviors that we want to engage in, and we avoid the things that we're not interested in taking part in. And so when we try to change people's behavior, it really requires conscious effort. We need to think about changing our behavior. So we need to think about either doing something, so for example, being more active, or we need to either think about not doing something. So if we think about our smoking behaviors or we think about our sitting behaviors. And many of the positive health behaviors that we're trying to encourage are disliked activities. So you think about the video that I just showed, we're viewing physical activity as something that's disliked and they didn't want to take part in it. So when we want to change people's behaviors at a first level, these individuals need to have motivation to change. So I'm going to talk about some of the strategies that I've used to increase motivation to change behavior. And so this is some of my PhD work where I worked with a sample of relatives of colon cancer patients. So we looked at this sample because we consider them to be an at-risk population. So these were individuals who were inactive. These were individuals who had a relative who had had colon cancer. So we know that colon cancer can be genetic. But we also know that just by being a relative of someone, you're exposed to similar health behaviors. Okay, so your activity levels could be similar. You're exposed to the same behaviors. You're exposed to similar eating habits as well as drinking behaviors. All things that we know are risk factors for the development of colon cancer. And so what we use is a very kind of simple, effective strategy to help people change their motivation. And we created a media-based education strategy where we actually created a DVD that presented information about the benefits of being active for colon cancer. And so we presented information such as your risk of developing colon cancer. We had information related to the severity of colon cancer, all presented by an oncologist. And then we also had some really key exercise or physical activity information focusing on strategies that could help them be more active. So we talked about things that are really kind of simple strategies that people can do in their own lives. So such as behavioral cues. You know, making sure that you have your running shoes by the door so that you're thinking about when you're going to be active next. Things like instead of trying to get that closest parking spot near the store, well, why not thinking about parking a little bit further away so that you have to walk? We talked about things like using the stairs, simple strategies that people can use to be a little bit more active. And then we also talked about the benefits of being active for reducing the risk of colon cancer. And so we presented the literature on that. And what we found is that this simple intervention, it was only a 15-minute DVD, was successful at increasing individuals' motivation to be active. And then what we did is we continued to follow up with this population, and we talked about some of the things that we know are really important when people are trying to be active, such as scheduling your activity. We talked about goal setting, and I'll talk about that again in a little bit. We talked about relapse and the barriers that keep you from being active and overcoming those barriers with developing some neat little strategies. So we talked about all kinds of different things, and as I mentioned, this was a very successful strategy for increasing motivation to be active. I'm going to shift focus and talk a little bit now about some of the work that I've done in cancer survivors and talk about some of the strategies that I've used. And the strategies that I'm talking about, I think, are strategies that you can also take home if you wanted to be a little bit more active. So that's kind of the take-home message, is some of these strategies are transferable to you. And I think that they're really neat strategies that are really effective but very simple. So when we talk about physical activity in cancer survivors, what we know from the literature is that it is safe and feasible for cancer survivors to take part in physical activity. If individuals are regularly active, what we see is they can have improvements in their quality of life. They can have improvements in their cancer symptom management. We see improvements in strength and fatigue levels improve. We see decreases in depression and increase in body image satisfaction. We see social, emotional, psychological, as well as physical functioning improvements. And then also some of the new literature that's coming out is suggesting that by being active, you can reduce your risk of cancer recurrence and cancer progression. We can reduce your risk of cancer-specific mortality as well as all-cause mortality. So we're seeing that being active is something that is very important for cancer survivors. Unfortunately, what we know is that cancer survivors struggle to be active. And we see that their participation rates decline during treatment and that they may never regain pre-diagnosis levels. When we look at some of the population-based research that we have out there, we see that up to 70% of cancer survivors are not active enough to get those health benefits that I talked about. So again, this offers us with a really unique opportunity to help cancer survivors to become more active. So some of the work that I've done has really focused on asking cancer survivors about physical activity and finding out what they want to hear from us. And this information really informs when we develop our interventions for them. So what we're learning and some of the questions that we ask are, do you feel that you're able to take part in physical activity? Do you have an interest in being physically active? We ask questions related to when they want to become more physically active and start their physical activity programming. We ask questions related to who they might want to be active with. And we ask questions about who they want to receive physical activity information from. And this is some results from some work that I did with colorectal cancer survivors. And we see that 81% of colorectal cancer survivors identify that they are able to take part in physical activity, and 78% of them identify that they are interested in physical activity programs specifically designed for cancer survivors. We also always ask them about who they want to receive their physical activity information from. And what we see predominantly in the literature is that they want that information to come from somebody within their cancer care team. So we see the fitness expert at the cancer center, we see oncologists, we see physiotherapists in the cancer center, nutritionists, support group, some aspect of their support group, fitness experts as well as nurses. But then when we ask them, have they received any information about physical activity during their cancer journey, only 28% of them had identified that anybody in their cancer support team had mentioned physical activity. So this is really a missed opportunity. And I think this happens for a number of different reasons. So it happens because oncologists and the cancer support team, they're very busy. They have other focuses. And I think they also just don't have the training to be able to properly counsel individuals to be more physically active. And so I think this really offers an opportunity for the students that we have here in the School of Human Kinetics to really step into these clinical settings and be able to promote and prescribe physical activity. So I think our kinesiologists would be a great fit there, as well as some of the therapeutic recreation students. They really have a lot to offer this field. So I'm going to switch gears and talk a little bit about some of the strategies that I have used with cancer survivors to help them be more active. And so these are very simple strategies. These are strategies that we see being used in the business world to increase productivity. These are strategies that we see being used in sports psychology to enhance performance. And we see these also being used in the exercise world or activity world to make people be more active. And so these strategies, the two strategies that I'm going to talk about, are strategies that I've used in a sample of prostate cancer survivors. And it's also strategies that we're using currently now here in Newfoundland in a sample of older prostate and breast cancer survivors. That's some of the work that my grad student Richard Bio is doing. And so I'm going to talk just a little bit about goal setting and why we use goal setting for physical activity. So we use goal setting because it really provides individuals with a map of where they want to go and a plan of how they're going to get there. So what it does is it focuses individuals' efforts and thoughts towards achieving their goal. And what it does is it enhances commitment and effectiveness. It enhances their confidence and their motivation by creating a plan and allowing them to see progress. And what I always do is use a map to demonstrate goal setting, so that if, for example, we were thinking about traveling from St. John's to Corner Brook, that can seem like quite a daunting task. But when we go into Google Maps and we get the turn-by-turn directions and we break it down, it seems like a much easier task. And so that's one of the reasons why we use goal setting, because it allows you to see progress along the way, and it allows you to break down your goals so that you can see progress and feel a little bit more confident. Some of the things that we encourage when we talk about goal setting is we encourage following these SMART goal setting principles. So when you do set your goal, you want to make sure that it's a very specific goal, so detailing exactly what you would like to do. It's measurable so that it can be evaluated, so you know your progress towards it. It's a goal that's attainable, so it's realistic but still challenging. It's something that is very relevant to you in that's important and it's valuable. And it's something that's time-bound, so you have a time frame related to your goal. One of the strategies also that we use directly related to goal setting is this idea of planning. And so planning really takes the guesswork out of being active. And it's really putting your intentions or your motivations into action. And when we look at the research, if we pair goal setting and planning, we see that it's much more successful. So what do we plan when we're planning our physical activity? We plan things like the who, the what, the where, the when, and the how related to your activity. So we plan the who. Who are you going to be active with? Are you going to be somebody who goes for runs alone and listens to music? Are you somebody who's going to take your dog out for walks? The what does your activity look like? So actually going in and planning what types of activity you're going to engage in. We talk about the where your activity is going to take place. We look at the when, which goes back to the scheduling, which I talked about earlier, which is very important for physical activity. And then we also talk about the how. So what are the logistics? How are you getting to your physical activity, and other things related to that. One of the other things that we do is we identify the barriers that keep you from being active, and then we come up with some strategies that you can use when you encounter that barrier so that you yourself can be more active. And so this strategy, so this goal setting and planning intervention was something that I developed during my postdoctoral training at the University of Alberta. And this is actually something that this very intervention is now being used in exercise guidebooks that are being developed for our cancer survivors. And so I was asked last month to review the guidebook that you can see there, which is for kidney cancer survivors, and it's actually featured directly in that guidebook. So very simple strategies, but very effective at increasing behavior. And what we found in our sample of prostate cancer survivors, they actually completed it on their own, and we found that just even completing this simple activity helped increase their physical activity levels. So what are some of my take-home messages? I think one of the take-home messages that I want you to leave with is that regardless of your age, regardless of your gender, regardless of how active you've been in the past, you can be more active now. And what you need to do is actually just find an activity that you enjoy. Find something that you enjoy, because we always get asked, well, what's the best activity to take part in? What's the biggest bang for your buck? Well, the reality is the biggest bang is going to be from the activity that you take part in regularly. So find something that you really enjoy doing. Having that goal and having that plan for success is going to be something that is very important. And we always get a barrier of time that comes up. So people feel that they just don't have time to be active. And I could tell you that you will find time if you make physical activity and you make yourself a priority. So you need to make sure that you make yourself that priority and your health a priority. And then I also want to just encourage you to think about small, simple changes that you can incorporate to add more physical activity to your life. So whether it's taking the stairs, whether it's that strategy of parking further away, whether it's getting up from your desk every hour and walking around for a few minutes. These very simple strategies can have a big impact on your health. So I'm going to finish off by talking about some of the work that Dr. Cameron and I are doing now. So when we initially started meeting and we started talking about our own areas of research, we decided that we wanted to find something that we could start doing right now that really looked at both of our areas of expertise. And what we came up with is cancer stigma. And so we do have some literature in the cancer stigma world talking about cancer being a stigmatized disease. Most of the evidence that we have, though, is from lung cancer populations. And unfortunately, that's problematic because we see lung cancer being stigmatized dually. So we see them being stigmatized because they have cancer and also being stigmatized because it's the view that they caused their own cancer. So what we're looking to do is to look at prostate cancer stigma. And this is very timely because Prostate Cancer Canada just sent out a report saying it's time to end the stigma. And so what we're doing right now, actually just started today, is we're doing some interviews with prostate cancer survivors, and we're learning about their lived experiences with stigma. So what does it look like? And from there, what we're going to do is we're hoping to create a prostate cancer stigma questionnaire so that we can more fully understand what prostate cancer stigma looks like. And then what we're looking to do is to develop a healthcare reduction strategy for stigma so that we can train healthcare providers to be able to identify when a prostate cancer survivor is identifying and dealing with stigma so that they can help reduce the experiences that they're feeling. And the last thing I'm going to chat about is our HIPP collaborative. So that's our Health Innovation Through Promotion and Practice collaborative. So when Erin joined the faculty last year, we started to chat about our research, as I had mentioned, and we both found that we were very passionate about health promotion. And so what we wanted to do is really promote all of the fantastic work that is being done and help that work get translated into practice. So we want the individuals that could benefit most from this health promotion information getting the information. And so we're really interested in promoting what we do, promoting what the faculty here is doing, the School of Human Kinetics and Recreation, and all the great initiatives that are going on here, promoting as well what's going on in Newfoundland and promoting what's going on in Canada as well, because there's lots of fabulous strategies that are happening. And we're also really interested in making linkages to the community because that's where the groundwork is going to happen and that's where we're going to see change. So we're interested in linking researchers to community and linking community to researchers that can help with some health promotion strategies. So just some contact details there. So you can contact us if you're somebody who's interested in health promotion, you'd like to get involved with the HIPP, you'd like a little bit more information. You can also follow us online at Twitter. We are active on Twitter promoting health and well-being. We also have a website that's coming soon, so we're just doing the finishing touches at the moment for the website. And I just want to leave you with our HIPP to be Healthy, which is our official launch event, which is coming up next month, so in Saturday, November 21st. So we hope that you'll come out. We have 2 launch events that are happening. We have an event for kids, which will be run through our physical literacy program here that runs in the School of Human Kinetics and Recreation. And we also have an adult event that will be coming up as well. So on the same day at the same time, we're going to be hosting something in conjunction with the Works, and we're going to be running a spin-a-thon. So lots of opportunities to come and be active and healthy together. And more details to follow. Thank you.